Sri M.B.Rajesh.
Thank you, sir, for giving me this opportunity to speak on this important debate on Sustainable Development Goals. Sir, I am coming from a state. I'm proud to say that I am coming from a state, Kerala, which is far ahead in social development and human development indicators. And almost all these targets have been achieved by our states. These social development targets have been achieved by our states much before. Though during last assembly election campaign, even our Prime Minister was confused, our state Kerala with Somalia. So that is not the case, sir. I would like to clarify that I would like to clear his confusion too, using this opportunity. Sir, in September, United Nations General Assembly is set to adopt Sustainable Development Goals. Before that, few months back, 193 countries came together at the UN Summit on Sustainable Development Goals. Our Prime Minister, Sri Narendra Modi ji, had attended and addressed that UN Summit on Sustainable Development Goals, and he stressed India's commitment to work towards these goals by 2030. Sir, this Sustainable Development Goals comprises of 17 goals and 169 targets. This is an improvement on Millennium Development Goals adopted in year 2000. Sir, a major critique of Millennium Development Goals has been that their scope, the scope of Millennium Development Goals was limited and it was vague. So that was the major criticism raised against MDGs. These MDGs set such low bar targets leading to defining development down. And the targets set under MDGs, these targets were diluting the definition of development itself. While MDGs were minimum standards, Sustainable Development Goals integrating environmental, economic and social dimensions are considered as more comprehensive list of global goals the world has ever committed to. So in that sense, it's a far better concept, and it is an improvement on Millennium Development Goals. And sir, the process through which SDGs were evolved is also more comprehensive and inclusive. SDG is the result of a 3-year-long consultation from an open working group to consultative conversations across both teams and countries. Sir, United Nations even launched an online My World survey portal asking people to vote to ascertain issues and goals that matter more. So this is the result of a more inclusive and democratic and consultative process. And I believe that Sustainable Development Goals can trigger a public discourse, not only at the international level, but in our country too. This can trigger a public debate, forcing the government to think about development from people's perspective. And this will bring some amount of accountability also to the government, the working of government departments and ministries. And we will be able to ask frequent questions to the government about the targets set under SDGs, what you have done to achieve these targets, what is your roadmap in achieving these targets. Through these various means, SDGs can be used as a weapon to bring government accountable to their social commitment. Sir, what has been our experience in meeting the targets and goals under Millennium Development Goals? Even in meeting the low-bar commitments of MDGs, Millennium Development Goals, our results were not at all encouraging. According to a UNDP report, out of 8 Millennium Development Goals and 12 targets, we were rated as slow on 4. And we were rated on track only on 4. And in another 4, we were rated as moderate. So this is our experience of achieving MDG targets. And government described this as mixed results. Even these mixed results are misleading because I got this UNDP report, and it says that a target of halving proportion of people who suffer from hunger between 1990 and 2015, and our progress is rated as slow. And on maternal mortality ratio, our progress is slow. And sustainable access to safe drinking water and basic sanitation is slow. So this is the record of our achievement as far as MDG is concerned. So why I am saying that, even these mixed results are misleading, because we were not successful in setting relevant indicators to measure outcome. Quality education, safe drinking water, the indicators to measure outcomes in these fields were not relevant and were not specific. Sir, according to government's official data, this data suggests that 86% of Indians have access to safe drinking water, and we are on track for the MDG goals as for drinking water. So this is not true, we all know. This is not true. We know that 86% of Indians do not have access to safe drinking water. According to official notions, this pipe water, borewell, etc. are considered as safe pipe drinking water. So this is not the case. And even the number of waterborne diseases and deaths due to diarrhea and cholera indicate this is not the case. So even after diluting this concept and notions of safe drinking water, quality education, etc., we are still not on track. So this is a reality. Sir, I'm sorry to say that almost all these treasury benches are not listening to this serious debate.
Not interested for development.
Treasury benches are not at all interested to listen to this, even after your intervention. They are not bothered about that, sir. Yes. Sir, even though they are not interested or they are not very serious about that, I know Prakash Javadekar is always serious about discussions. But unfortunately, most of his colleagues are not. Sir, now coming to the challenges. Now coming...
Sometimes cameras should focus on that part also. Let the whole world know.
Now coming to the challenges in implementing sustainable development goals. A major challenge is financing of SDGs. How can we find resources, sufficient resources to finance sustainable development goals? A new study has estimated that implementing SDGs will cost around $14.4 billion. That amounts to roughly 92,000 crores of rupees. Less than 1 lakh crores. But the major challenge is that in the post-liberalization era, the trend shows that the trend is that of a declining trend of social sector spending. the public spending on social sector has been showing a declining trend all through these 25 years of neoliberal policies, except for 4 years when the left supported UPA 1. Only in that 4 years, when the left supported UPA 1, because of the pressure exerted by the left, the social sector spending showed some improvement. Apart from these 4 years, the trend is not encouraging as far as social sector spending is concerned. Sir, according to United Nations Millennium Development Goals 2014 report, a report of 2014 on Millennium Development Goals, it's a UN report. 1/3 of the world's 1.2 billion extreme poor lives in India alone. 1.2 billion extreme poor, and 1/3 of this 1.2 billion lives in India alone. So we are facing such a big, huge challenge. Sir, this shows that there is no shortcut to meet these goals. There is no shortcut to fulfill the sustainable development goals, but to enhance public investment in social sectors in a massive manner. So what we need is massive enhancement of public investment in social sectors. The left has always been advocating the need for massive investment in social sectors like health and education. Sir, sectors like health and education are crucial in achieving these sustainable development goals. India is a country which has, according to various studies, India is a country which has highest out-of-pocket expenditure on healthcare. And we should understand that India is a country, India has fourth largest private healthcare system in the world. On the one hand, we are having the highest out-of-pocket expenditure on healthcare, and on the other hand, India has the fourth largest private healthcare system in the world. So this shows that, and more details, more facts are here. 60 million people fall into poverty just paying for healthcare expenditure. Just paying for healthcare, 60 million people fall into poverty in our country. So what does it mean? This means that there is an urgent need for enhancing public investment, public spending on healthcare. There is a need for provisioning public healthcare system and improving and strengthening public healthcare system in our country. So India still spends, despite all these facts, we must understand that India still spends less than 2% of our GDP on health. Even our National Health Policy 2015 envisages only 2.5% of GDP on health, spending only 2.5% of GDP on health. So this shows that despite these facts, despite this reality, and despite our commitment to sustainable development goals, we are not ready to
Right.
I'm concluding, sir. We are not ready to enhance our public investment in health and education. Sir, progress in the rate of reducing infant mortality and maternal mortality, we are lagging far behind in these sectors as far as MDG is concerned. And the progress shows that the rate of reducing infant mortality and maternal mortality, the pace is far less than Bangladesh and Nepal. Bangladesh and Nepal have surpassed us as far as the pace of reducing maternal and infant mortality is concerned. And we are close to Pakistan, as in many other respects. As Fahmida Riaz, Pakistani poet, said, we are increasingly getting closer to Pakistan on many other aspects. So at least in this aspect also, reducing maternal mortality, we are more close to Pakistan, and Bangladesh and Nepal have surpassed us. So this is the reality. Still we are not increasing our investment and spending on public health. Sir, on education, see the famous Kothari Commission recommendation of spending 6% of GDP on education. It was in 1968. Decades have passed since then, but we have not yet reached that mark. Still we are at 4%. Still we are spending only 4% of GDP on education.
Okay.
And compare this with a tiny island country, Cuba, which is spending 18% on education. So that is a comparison. Yes. And despite being a small country, and despite not having this spectacular GDP growth, they are spending 18% on education, and we are spending only on 4%. And our own commitment, as far according to Kothari Commission report, is 6% on education. Sir, this is my last point. I'm completing. This is my last point. You have been generous to all other members, sir. Please be generous, sir. Sir. Yes, this is my last point. My last point is that in order to achieve social development, sustainable development goals, we must invest in our children, we must in our youth, and we must in our future. So, sir, the neglect of social sectors has cost us dearly. Our poor ranking in human development indicators, that is the cost of this neglect.
All right.
Sir, 2 more minutes. 2 more. I will conclude in 2 minutes, sir. You have been generous. Sir. I will conclude in 2 minutes. 2 minutes, sir.
16 minutes I allowed.
Sir, according to UNDP's HDI ranking, our position is 136. We are having a much worse position, ranking.
Right.
Only in football. According to FIFA ranking, it is 166, and according to HDI ranking of UNDP, it is 136. So finally, so my point is simple, sir. My point is simple, sir. In order to achieve these sustainable development goals, we need to have a strong political will. Yes, we have 56-inch Prime Minister, and inside this 56-inch, we need a broad, strong will to achieve these targets. With these words, I conclude. Thank you very much.